Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D. Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your aging parents, spouses, family, and friends to listen to the show. If you have a question or an idea for a future program, share your idea with me by responding to my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. For this show, I'm here to answer the caregiver question. Why do old people not go to the doctor? I will share 8 reasons why people, not only the elderly, avoid going to the doctor, plus a few reasons why people do decide to seek medical care. Know that these are not in any particular order, and I'll be interested to know how many of you relate to these examples. The number one answer to why do old people not go to the doctor is they don't see the need. How many of you think, oh, it will get better with time, or I'm not sick enough to see a doctor? Well, if you are young and generally healthy, both of these statements may be true. However, if you have older parents, grandparents, or spouses with a lot of health issues, waiting can have serious negative consequences. Don't wait. Waiting can mean a diagnosis of a disease which, if caught 6 months earlier, could have been treated. But today, it can't be treated. It may lead to a lot of pain and suffering or the eventual death of a parent or another loved one. Not going to the doctor until a person can't get out of bed or is terribly sick can also result in serious illness, a great deal of unnecessary suffering, or even a trip to the emergency room. The number 2 answer for why do old people not go to the doctor is fear of being diagnosed with a severe illness. So the idea of, oh, it will get better, may have a foundation in fear. What if it doesn't get better? Elderly parents and adults of all ages fear receiving bad news, not just about health, but we don't like to receive any bad news. That's normal, right? Doctors, though, also don't want to give bad news, so many don't unless patients ask them directly and specifically. Some caregivers and older adults say that going to the doctor makes them think of death or dying. Others fear going to the doctor because they don't want to receive that diagnosis that may have potentially painful treatments. Here's the important insight. If your main fears are death and pain and suffering, seeing a doctor earlier rather than later might be able to prevent all of these. Uncertainty about anything can lead to worry, right? Worry about what might happen tomorrow, next week, next month, next year. Family caregivers are in constant worry about what will happen tomorrow. Instead of worrying, why not take action to prevent health concerns? Gain certainty and get the facts, especially about a health problem. It's the only way to reduce or manage worry about going to see the doctor. So rather than waiting or saying, oh, it will get better with time, or I'm not sick enough to see the doctor. Make the appointment. Take your parent, spouse, or loved one to the doctor. Learn about the health diagnosis. Ask questions about treatment and the consequences of how the health issue might progress to avoid surprises. I know you're thinking doctor appointments are such a hassle. I don't disagree. Making doctor appointments, the wait time at the appointments, the wait time to get an appointment, trying to get anybody to answer the phone at the doctor's office and help you. These are all reasons that caregivers, older adults, say that they have an unfavorable opinion of the healthcare system. All of these interactions combined are the number 3 reason for why do old people not go to the doctor. Then we have many elderly people feeling ignored, which is why they don't want to see the doctor. So let's say that you call the doctor's office and you have to go through one of those crazy phone trees, +1 for this, 2 for this, 3 for this, and then you never actually get a real person, right? You have to leave a message, sometimes even to make an appointment. And if you've done this, you know that it can be days before anybody calls you back, if they do call you back, right? This leads one to believe that doctors' offices are too busy to care about you. Or on the other hand, how many of you have been to a doctor's office and you had to wait hours because the doctor was late, maybe delayed due to surgery or other reasons? Now, if you're the patient that's late, they can threaten to cancel your appointment, yet it's okay for them to keep you waiting hours. Where is this level of mutual respect? It's missing. Some of you may have taken off work to take a parent to a doctor appointment or even to go to your own appointment. You told your boss that you'd be gone for 2 hours, and 2 hours have passed. You're looking at your watch, you're stressing out, and you haven't seen the doctor yet. It's so frustrating. These are all problems contributing to why people of all ages, including old people, don't want to go to doctor appointments. Then we have many older adults who don't have the physical stamina to sit in a doctor's office for 4 hours to wait to be seen, especially if they're not feeling well. And, if you don't get the first appointment of the day or the first appointment after lunch, the likelihood that you will be waiting increases by the number of patients scheduled before you. The hassle factor of dealing with medical offices with staff who don't seem to care is a deterrent that answers the question, why do old people not go to the doctor? Add to this, your parents may feel guilty asking you to take time off work to take them to the doctor. An alternative to in-person appointments and waiting can be a doctor's office that has an online portal where you can go on your computer and schedule appointments and communicate with the staff in a doctor's office about your care or the care of an elderly parent. That is assuming that you have permission to do that for your elderly parent. So my recommendation is ask if the healthcare provider, doctor, whoever, has an online portal. If so, using this can smooth out the challenges of scheduling appointments, save you a lot of time, and you can coordinate care helping your parents to get the help that they need. Let's talk about other common issues that consumers and patients experience. Prescriptions. How many of you have been written a prescription by your doctor or have had a prescription sent to your pharmacy? You get there and the pharmacist tells you that the medicine is not in your insurance formulary. What does that mean? Well, it simply means that your insurance company refuses to approve the drug. Now, it can take days for your pharmacist to go back and forth with your doctor and the insurance company to figure out what medicine your insurance company will pay for. So if this happens, ask the pharmacist the cost of the medicine without insurance, or if they have any insurance discount cards that can be used so that you don't have to wait. If you or an elderly parent is really sick, any delay in getting medication can be a significant problem that ends you or a loved one up in the hospital emergency room for treatment. For 20 years, I managed the care of many older adults. My staff and I have spent hours on hold with doctors' offices, insurance companies, and other healthcare providers. I know that it can be frustrating and that many times you may want to give up. Don't. Don't give the healthcare system the satisfaction of not giving you care. In my experience, health insurance companies can make it difficult to receive care, but so also can doctor's offices or providers who don't know how to submit information. So here's some terminology for you. Health insurance companies, including Medicare and Medicaid, are called payers by the healthcare system, meaning they're the ones that pay for your care. Now, when you give up trying to get a prescription or get a treatment or something, the only person you place at risk of pain and suffering is you or an elderly parent. You don't want to look back weeks, months, or years from now and say, if only I didn't give up on that medication or treatment. Or if we didn't give up on seeing the doctor, we wouldn't be in this place with this illness or diagnosis causing so many problems and the pain and suffering that a parent is experiencing. Now, it is a fact that health insurance companies want to manage their costs. Now, it can appear that they do this by declining or restricting care. Sometimes, though, the problem is paperwork. It's a coding or a diagnosis code issued by a billing person in your doctor's office. It may really not be the health insurance company or the payer being purposely difficult. Here are more examples. It's the wrong prescription ordered by a doctor, an incorrect treatment code, a diagnosis code, a procedure code, the wrong national drug code number on a prescription order that can be wrong. All of this can delay prescriptions or pre-approval for services. And believe it or not, everybody's fighting this. Doctors, office staff, pharmacists, treatment centers, they fight insurance approval battles every day. Now, what I can tell you is that experienced billing coders know how to get things approved. Others who don't cause problems for patients. Instead of treating or helping patients, what happens is that doctors' office staff can spend hours on the phone with insurance companies, chasing down approvals, updating paperwork to get consumers and patients the care they need. Now, I know this because I've been through this myself for clients. All of these providers are equally as frustrated. So instead of giving up, ask your doctor's office, the pharmacist, or the healthcare provider what the problem or the delay is so that you know. Then get involved. Ask how you can help resolve issues, delays, or declines. You may have to spend a couple hours on the phone with the insurance company, but unless you do this, it can be difficult to get the care that you need. Another shock, you might also be surprised to know that many local pharmacies lose money on processing your prescriptions. Many times the payers bill them back, which sounds like it's crazy, right? Many of them are going out of business because of these companies called pharmacy benefit managers that are supposed to help consumers get their prescriptions faster, but they actually charge pharmacies more money. So all of these financial challenges that pharmacies and other providers are experiencing are why you see fewer independent medical clinics, pharmacies, physical therapy clinics, and labs. Doctors and these other providers have no other option but to join large healthcare systems because of the overwhelming amount of paperwork, administration costs involved in trying to help patients. And all this does is drive healthcare costs up, not down, and push struggles onto consumers. So until consumers and patients begin taking more responsibility for their care and learn what goes on behind the scenes, it can appear that health insurance companies will continue to decline or limit care. Caregivers, elderly people out there listening, and others, the way that you win is by learning to ask the right questions and being persistent to get the care that you need, and get on the phone if you have to with health insurance companies. All this happens because healthcare services are not a typical consumer good. All of the costs, the pricing, the approvals, they're hidden from consumers. So as a consumer, asking for healthcare transparency is a good thing. It's essential. So when you think of consumer goods like cereal or shampoo or other services, you know what they cost. It's printed on a menu. It's listed on the grocery store shelf. And so for many of these products or services, you may enjoy them. You may feel like you get good service from your beauty or your barbershop or your dentist. Now, when you compare all this to the healthcare system, do you feel like healthcare gives you a return for the money you spend? You probably don't, because you don't know the cost. You may be paying $10 for something that has a $5,000 price tag. So I know that most consumers would probably say that they don't feel they get good value or good treatment from going to the doctor, which is the problem. It's why we don't want to go. And it's also why avoiding medical care is becoming increasingly common, but that's not good for you. So let's take a short break. When we return, I will share reasons 4 through 8 for why do old people not go to the doctor. Please pay it forward to help others dealing with health, aging, or caregiving issues by sharing information about the Caring Generation podcast and my website, PamelaDWilson.com, where you will find my caregiver blog, online caregiver programs, and articles filled with proven practical tips and information. This podcast, Caring Generation, is available worldwide on my website and your favorite podcast and music apps, Apple, Spotify, Spreaker, and others. You can find links to all of these on my website. As a caregiver, please know that you don't have to go it alone. Caregiving doesn't have to be a frustrating do-it-yourself job or a struggle. Visit my website, and you can also find detailed information there about how to care for loved ones. Click on How I Help, and then support Caring for Parents online course. It's a free online course. Lots of hours of education for people who are truly interested in learning more. This is Pamela D. Wilson on the Caring Generation. Stay with me. I'll be right back. This is Pamela D. Wilson, caregiving expert, author, and speaker on the Caring Generation. If you are looking for answers to caregiving and aging questions, visit and share my website, PamelaDWilson.com, where you will find my caregiving library, Caring for Aging Parents blog, my book, The Caregiving Trap, online caregiver courses, and more. Let's return to why do old people not go to the doctor? How many of you, by the way, are finding similarities in a lot of these examples that might also relate to why you avoid medical care regardless of your age? It's just not the elderly who struggle to navigate the healthcare system, it's everyone. But it is true that older adults have more health problems. Let's jump back in. Let's talk about money and the cost of healthcare, which is a number 4 reason for why do old people not go to the doctor. Concerns about being able to afford copays or high health insurance deductibles are real. If you don't have the money to pay for these services, you are less likely to make your health a priority and less likely to see the doctor. Many elderly are on fixed incomes that may be limited to a monthly Social Security or retirement check. After retirement, the cost of everything else continues to increase. Look at the price of a gallon of gasoline today, groceries at the store, electricity, or rising rents. When paying for daily necessities is a concern, everything else for older people, including seeing a doctor, even for what you might believe is a minor problem, become a lower priority. Some older adults have to make choices between paying their rent and getting a prescription medication refilled. Being old and sick or being elderly and having many medical conditions has stress factors that may be difficult for adult children, who are their caregivers, to understand. If you're in this situation, as a caregiver for your parents or as the older adult, ask your doctor's billing office about a payment plan. Unless you ask, you won't know if it's possible. Being attentive to health and participating in healthy habits, like attending regular doctor appointments, can change life for the better. But unless you're in a position where you are willing to be persistent, learn information, and advocate for your needs, you may end up old and sick. Don't give up. Ask for help for your elderly parents and learn how to work through issues with medical care providers. Number 5, for why do older people not go to the doctor, is being embarrassed about health conditions or fear of the doctor nagging you. Embarrassment includes things like finding out that your blood sugar readings aren't as good as you hoped, your blood pressure is still frightening high, meaning you could have a stroke or a heart attack, or disappointment that your cholesterol readings haven't decreased despite changing your diet and eating a lot of oatmeal for the past 6 months. So things that may feel out of our control, or things that we're working on that haven't improved to the level that we hoped, can make us hesitate in going back to the doctor. Simple things like fear of needles could be another embarrassment, or the fact that you don't want to tell the doctor that you are participating in unhealthy behaviors like maybe drinking or smoking. Here's the scoop with all of these. Some things may be a little out of your control, like blood sugar or blood pressure, but only until you learn to do the things that you must do to bring these into positive levels. On the other hand, if drinking and smoking are on your no list and you can't stop, it can mean one of two things. One is that you don't believe these issues are important or that they are causing you any problems. 2, it could be that you are lacking support to change. So if support or willpower is the issue, ask your doctor for help. Changing habits isn't easy, it takes effort, but you can consider a smoking cessation program or attending a 12-step program, or maybe even both. Sometimes it can take extraordinary effort to change long-standing habits, and you may need the help of others in a similar situation. It's no different for family caregivers experiencing stress and pressure. Find a support group, in person or online, so that you can share and learn from others in similar situations. Other embarrassing or nagging situations. Not following through with doctor's orders to take medications. This is obviously a choice. However, it's important to ask what happens to health, the body, and the mind if medications are refused. Know the consequences of not taking actions that might improve your health, so that when your health gets worse, if you decide not to take medications, you can say, oh yes, this is what the doctor told me might happen, rather than, nobody told me this would happen. Become knowledgeable about your health and accountable for your actions. If you're caring for an elderly parent, you may witness a lot of refusals or not following recommendations. Your parents may refuse to go to the doctor. Back to embarrassment and nagging, reasons for why do old people not go to the doctor. As their caregiver, do your best to be empathetic and listen so that you're not added to the list of people who embarrass or nag your parents. Number 6, for why do old people not go to the doctor, includes distrust. Your parents may not trust the information that the doctor provides, or maybe they followed recommendations that didn't work out as expected. A lack of trust can relate back to difficulty receiving or understanding information that doctors prescribe. A lot of doctors speak in very complicated language that patients can't understand, and this can create situations of mistrust. A patient doesn't understand the doctor and are afraid to ask questions, or patients feel rushed out the door. Then if the doctor's office promised to follow up and did not, this can also lead to frustration about whether a doctor really cares, or you may think that that health issue that your doctor talked about isn't important or wasn't important. There's also other situations for why do old people not go to the doctor. that include low confidence in a doctor's experience. Maybe an elderly parent has been to the doctor multiple times, and it seems that their health is getting worse instead of better. Or it might feel that the doctor doesn't know what they're doing and they can't make the right diagnosis. They can't figure out what's wrong. They can't treat it. Other patients feel that doctors care more about money than patients. Here's an example. The doctor prescribes a really expensive medication that you see advertised on television. But when you ask the pharmacist is like, oh, there's a much less expensive option for that does the same thing. Other times, unnecessary tests might be prescribed by the doctor that make the healthcare system where the doctor practices more money, but really doesn't do anything for the patient. So if you have concerns about these, if any of these are the case, you've got a couple of options. Make the effort to explain your concerns to the doctor and ask questions. A lot of misunderstandings can be cleared up by communication. If that doesn't work, maybe it's time to change doctors to find one that you believe cares about you. Many times, general practitioners are not the best doctors for people over age 60, 70, or 80. You want to see a geriatrician or an internal medicine doctor who knows more about the aging body. On the other hand, some older adults place doctors high on a pedestal, which means that they don't feel comfortable asking questions, and they're not honest about their opinions or feelings about treatment recommendations. There's no way to get good care if you don't trust your doctor and if you don't speak up. Number 7, for why do old people not go to the doctor, can relate to transportation difficulties. When elderly parents don't have children or friends available to take them to the doctor, attending appointments can be a challenge. This difficulty ties into the use of technology that we'll talk about in a moment. While transportation may seem like a barrier for why do old people not go to the doctor, many cities have transportation services specifically for the elderly or disabled so that they can attend medical appointments. More and more healthcare providers are establishing doctor house call services. These are doctors that visit the elderly who are homebound, and homebound means they don't have a car, they can't drive, they can't physically leave their homes without a lot of outside help. So there are doctors that visit the elderly in their homes, assuming the elderly are homebound. For older adults who have a lot of complicated health issues, palliative or hospice care may be an alternative if pain management is a concern or if medical conditions have gone past the point where aggressive treatment just doesn't make any sense. The recommendation is to ask and investigate options about palliative care, hospice care, how to attend medical appointments if transportation is a problem. Many senior community centers have an information and referral person on staff who may be able to help you with transportation issues. Additionally, contact the local area agency on aging to ask about ride services for seniors. Number 8, for why do old people not go to the doctor, is a lack of experience or confidence in using technology. So earlier we talked about technology to schedule online or virtual appointments. Because of COVID, all these virtual appointments are very common these days, as long as that appointment is for routine care or an ongoing diagnosis. Now, obviously, the doctor needs to see you in person if you have a new concern or if some kind of ongoing concern just doesn't seem to get better. You may also need a referral to a specialist. Other uses of medical technology these days are apps and equipment that can help track exercise and nutrition and health concerns. For example, if a person has type 1 diabetes, monitoring of blood sugar levels can now be done with a continuous glucose monitor. It's also called a CGM. This little piece of amazing equipment takes and stores blood pressure or blood sugar readings, and when you go to the doctor can print out a document or look at your CGM. Insulin can now be supplied by the use of an insulin pump or another small piece of health technology. So there's no more finger sticks or injections if you combine a CGM and an insulin pump. Now, it can take training, and one does have to be interested and patient in learning how to use this technology and these these small pieces of equipment. For older adults who are not computer or tech literate, ask for help. A lot of patients today feel that their doctors, when they go to the appointment, you're talking to the doctor and the doctor's not looking at you, they're looking at the computer. And so older adults can feel ignored in those situations. But everything today is moving toward electronic medical records and systems that actually can be really great for doctors to share information about patients and for you to have easy access to your information. On the other hand, there are concerns about privacy and confidentiality when it comes to electronic medical systems. Some patients are suspicious about having to sign up for these portals and who has access to your information. Others may not have access, cellular access, to get text messages about appointments or to go online to sign up for appointments. So while health technology can be beneficial, there can be a learning curve, there can be an issue with internet speeds, with having access to a cell phone, but there's benefits to all of these in the long term. The solution for all of this, why don't people, including old people, go to the doctor, is consumers, family caregivers, and patients becoming more involved. For a lot of times, a lot of years, the provision of medical care has been one-sided. It's been the healthcare system talking to the patient. And this has been in place for so long that changing long-standing beliefs about healthcare works can take a bit of work. As a caregiver, I know I'm repeating myself. If you're caring for yourself as an older person or you're a caregiver for a parent, participate in all education about health diagnosis so that you can be more proactive. Identify incorrect beliefs that you have about health and aging. For example, all old people will be old and sick. Not true. Lifestyle habits beginning when you are very young contribute to health and well-being when you're older. And most of all, don't give up. Find others in similar situations who can inspire you to make positive changes that will help you improve or manage your health. And last but not least, let's look at why people are proactive about seeking information about health and taking consistent action. One reason is the obvious. You have a decline in physical or mental health. That's no surprise. Health that gets worse can be a motivation to seek solutions. Second reason, set an example for your children. Many people tell me that they want to set good examples for their children when they become parents, like embracing good health, not being fearful of seeing doctors, getting regular vaccinations. Elderly parents also can become more proactive about their health, but not know how to do that. So many, when they are curious, they can ask their children or other people to investigate information. Children, this is your option to educate your parents and get them to take action. The more that you know, the more that you can share with them. It's really the idea of being comfortable knowing that more information is out there, figuring out how to use it, asking for help from the medical system, and sharing all of this information with your loved ones. And the best reason to seek medical care and become educated about your health is so that you can avoid medical care and be healthy in later life. Be proactive. Identify diseases and problems early when they can be reversed. Don't wait to see the doctor because you think your problem is small or it's going to go away. It may be small today and huge in 6 months or a year. Take steps today to take care of you and your loved ones. Everyone, I thank you so much for joining me this week. Please share The Caring Generation and my website, PamelaDWilson.com, with everyone you know interested in proven, reliable tips, information, resources, and research about caregiving, aging, health, and everything in between. This is Pamela D Wilson, caregiving expert, advocate, and speaker. I look forward to being with you again soon. God bless you all. Sleep well tonight. Have a fabulous day tomorrow and a great week until we are here together again.
Tune in each week for The Caring Generation with host Pamela D Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D Wilson's The Caring Generation.